everyone, and welcome to Connecting the Dots with Dr. Ashaye. This is a great place to be if you desire to take charge of your health so you can live fully while enjoying doing what you love. I'm here with a special guest, Dr. Tolu Alugo. She's a child and adolescent psychiatrist and founder of St. John Children Adolescent Psychiatry program, also known as Saintjohncapp, and the Emotions Ambassador program. She is also the host of Walking on Eggshells with Dr. Tolu, which is a podcast, and she has a YouTube channel called Saintjohncapp. So today we're going to be discussing ADHD, Attention Deficit Hyperactivity Disorder. Welcome, Dr. Alugo.
Thank you very much, Dr. Ashaye, for having me. I really appreciate this. Thanks.
Yeah, thank you for coming. But before we get into it, you know by now you're listening to Connecting the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care, which is a membership clinic in Sugar Land, Texas. And I am so excited you're here. If you are seeking a much more convenient and proactive approach to your healthcare, come join us. You can enroll at www.intouchprimarycare.com. And remember, you can always listen to this episode and all our episodes on the In Touch Primary Care YouTube channel. Leave comments, subscribe, and please share. You never know who may need it, and it may make such a big difference for them. All right, so we're going to get into it. So Dr. Tolu, or Dr. Alugo, whichever one you prefer.
I don't mind either.
You don't mind it. What would you like to share about yourself, personally or professionally?
Well, like you said, I'm a child and adolescent psychiatrist, but I'm very passionate about early intervention and prevention. And really, a lot of the work I do is geared towards those two areas, early intervention and prevention.
Yeah, absolutely. Those are so key. And that's what I love, that, you know, we're on the same page for sure. Prevention is so key. So you are a child and adolescent psychiatrist, which is a very, very needed specialty. So thank you. What are some common conditions you treat in your patient population and how?
So, I mean, the different conditions vary with age. So starting from elementary school, it may be things like ADHD, like we're discussing today, autism, anxiety. Older kids, again, anxiety, depression, eating disorders, psychotic disorders, substance use. So the whole gamut of mental health disorders just vary with the different age groups that we see. And you said how? So through a variety of means. So we would usually by providing diagnostic assessments, providing treatment plans that would include using different strategies, including other professionals coming in. So an interdisciplinary approach to mental health care is really the goal. So where we're advocating for talking therapy, for behavioral therapy, sometimes occupational therapy, looking at the whole child and providing direction to the entire team, as well as providing information to parents so that they can also parent better and support their own mental health.
Yeah, absolutely. Like it takes a whole team of people for sure. And like you said, mental health is part of it and a huge part of it, but there's also the rest of the whole health. So someone listening may have a child that maybe has a lot of energy, maybe seems to get easily distracted. How do they know if they should be concerned about ADHD or even ADD?
So for in mental health, for us to say a child has a disorder, it means that it's impacting on their functioning. So where the symptoms of hyperactivity, inattentiveness, or impulsivity are really in excess of what you would expect for a child of the same age group and are negatively impacting them at school, at home, and in the community. I see many parents with kids who are less than 5 and they're thinking their kid has ADHD, but it's normal for a child who is younger than 5 to want to run around, to not want to listen. But then when you compare that 5-year-old to other 5-year-olds, when it comes to sitting down for circle time in preschool, for example, or, listening during after school activities or daycare activities, are they really an outlier? Are there symptoms in excess of what you would expect for that age group? And are these symptoms affecting them to the point where the daycare is saying, we don't think we can handle your child, then that is time for you to begin to look a bit closer and get some help.
Yeah. And I think that's why, we already talked about how it usually a number of people are involved. And I know particularly with ADHD or even ADD, having the teacher's input or the daycare's input can be very helpful because they see other 5-year-olds or other 3-year-olds or other, children of the same age. And so they can use that lens. Because when you're a parent, especially as a first-time parent, you don't know what other people, what other children look like. So sometimes it's hard. But when you have the input of, the other people, it could be helpful too.
That's true. I'm very into educating teachers because school is really like home away from home. So when a teacher is able to pick up things quickly, it helps a child. And so they're able to support families. And then it helps me as a psychiatrist because when they come back to see me, they're able to say, oh, Johnny's teacher says he's doing better or there's no difference. And then I can then tweak my treatment plan. So teachers are a great part or an integral part of the treatment plan in children or for any condition at all.
Yeah, absolutely. Okay. So are there any harms? Because I know there are people that maybe their child has been diagnosed with ADHD and they are not wanting to go forward with any kind of treatment. They just kind of, maybe don't want to deal with it or afraid about what dealing with it might mean. Are there any harms of not addressing or treating ADHD?
Definitely. I mean, so we know ADHD affects 3 domains. So there's the hyperactivity, there's the inattentiveness, and the impulsivity. And I'm going to divide the that of not treating into those 3 areas. So one is the hyperactivity. Sometimes they're so disruptive in class that schools are saying, we can't handle this child. So then they may actually cut down their school day. That's a child not getting full benefit of education. They're so hyperactive, they're getting into, or they're impulsive, they're getting into dangerous situations. I've had kids with fractures because they jump out of top floors of their home or run across the street. The teenagers, there is really risky behavior of substance use, driving too fast, unwanted pregnancies, just getting into, relationships, without thinking through the consequences. There's also gaps in their learning. So some children are not hyperactive, they're not impulsive, but they're sitting in class just daydreaming. And so there are huge gaps in their learning that would not otherwise be there if they got help early. So, early intervention and treatment is important. And parents need to realize treatment doesn't always mean pills. There's so many other things that can be done first. So it's important to get help as early as you can.
Yeah, and thank you for saying that because I think, some parents just assume that, oh, they're just going to be medicated and so they're resistant to help. But knowing that there are other things that can be done, I think can put them at ease. But understanding also that there are consequences to not doing anything. So, if you're listening and you know someone that has ADHD or your child has ADHD, please don't ignore it. There are things that can be done. And it's important to address because it has real life consequences. So, okay. So I currently have a patient. She's a teenager with ADHD and she's decided not to take medications. Can she still thrive with this condition? And what are 3 practical things she can do?
So I'll just give a couple of practical tips. You can thrive with this condition. And again, we look at severity to determine whether or not we need to look at medication. So for this individual, it depends on how severe their symptoms are. But obviously, yes, we want to start with non-pharmacological strategies. So if it's hyperactivity, things like giving themselves frequent opportunities to expend energy, like exercising, taking regular movement breaks, that's one thing. If it's sometimes using a fidget, if it's because they get easily distracted, using noise canceling headphones, reminders to like task lists, checklists that they can put in a place, like maybe at the door of their house or the door of the fridge, so that before they leave home, they can go through a checklist of all the items they should have, setting reminders on their phones. I think I've gone over 3 now, but so dealing with hyperactivity, expending energy, using lists, using reminders, noise cancelling headphones are a few of the things that, and then chunking their tasks into small manageable time frames, like saying every 15 minutes I'll take a break. Sometimes that also helps.
Awesome. Yeah. So that's really good to know, because I think there are strategies that people can put in place that to help them, to deal with it. And regardless of, even for people that do have to take medication, I do think having those strategies are so important regardless, because it just gives you, it probably would lessen how much medication you have to take. And generally, just throughout your life, you're able to implement those strategies, and that makes a big difference. So, let's go into your program, Saintjohncapp. What does it offer to children and their families?
So really, Saintjohncapp is the education arm of my practice. So really, it's about providing education. We know in mental health that once a patient or their family has enough information, that's half of the battle. So it's we call it psychoeducation, providing information about different mental health diagnoses is what we do. On helping people to understand the diagnosis, helping parents to understand how to get help, the early warning signs. So that is one thing that Saintjohncapp is about. And I do that through different social media platforms, so Facebook, YouTube, Instagram, bringing professionals in the field to talk about, different disorders. Also bringing people who have those conditions to discuss their lived experience of having a mental health condition and how they've been able to get past those hurdles, what they found useful. Particularly with ADHD, I did an interview with a physician with ADHD who now is a life coach for other physicians with ADHD. And it just, a lot of parents have said to me that is a great resource because it gives them hope that, with ADHD, you can still achieve a lot. I also know that for parents, it's a huge burden having a child with any chronic health condition, not just mental health. So through my podcast, I provide strategies to help those parents manage their own emotional health. Because remember when we're flying in a plane, they say before you put on your own face mask, your child's face mask, you should put yours on first for your oxygen mask. So parents need to look after their own mental health first, their emotional health first, so that they can better parent their child who has a mental health diagnosis. And that is the goal of the Working on the Eggshells with Dr. Tolu podcast.
Awesome. Yeah, those are both great resources. So I hope, if you listen and you think this might be applicable to you, please check them out. Was going to ask, you're in Canada, but this resources are available online, so you can, tap into these resources.
Yeah, they're available online. And I have an online course called the Emotions Ambassador Program. And this is really just for preteens to help with developing their emotional health awareness, so they understand what healthy emotions are, the importance of like a healthy diet, their emotions, healthy exercise, normalizing help-seeking behavior, understanding friendships, bullying, just those kind of conversations that sometimes may be difficult to have with a preteen. This course helps begin to it's like a launch pad for those conversations. It's self-paced, it's 8 lessons, and it's really providing mental health information in an age-appropriate manner for kids between the ages of 8 and 12. And that's also available via my website.
Awesome. Yeah. So these are really great resources and much needed. And I'm glad that, you've been able to put that together, because I know, having a child psychiatrist, a child and adolescent psychiatrist is, it's something that people have to wait a long time to find a good one and to, connect with someone. And this is great that you have this available online for our listeners. Great. So any parting words, any advice or anything that you want to leave us with today?
Well, just to say that for parents of kids who may have ADHD symptoms, it's not your fault. ADHD doesn't happen because of poor parenting, but parents can go a long way in changing the child's trajectory by, really getting information, by getting help early, and by learning strategies that they can use to manage their child. So it's not your fault, but your role is important in helping your child manage their symptoms.
Thank you. Thank you for sharing that. And, it's finding help early because like we talked about, there are consequences of not having help, and we can prevent a lot of those consequences when we get the help early, sooner and later. So, okay, great. So how can people find you? We talked about the courses and programs that you offer. Where can they go to find this information?
So my website is www.saintjohncapp.com. That is Saint John, SAINTJOHNCAPP.com. And you can access the Emotions Ambassador program through that. There's also a blog you can access. I have a podcast called Walking on Eggshells with Dr. Tolu on any platform that you can find a podcast on. I'm on YouTube as Saintjohncapp and also on Instagram and Facebook as Saintjohncapp.
Great. So please check it out. We're going to have all that information in the comments so you can access them easily. And thank you for listening. That's what we have for today. Thank you so much, Dr. Tolu. Thank you for coming and sharing all this wisdom with us this morning or today.
Thank you very much for having me. This is a great platform, and it's great how you're educating your patients and the community. Well done.
Thank you. So thank you for listening, and remember to subscribe and to share with someone who may need it. And if you're in the Houston area and you like to experience the peace of mind that comes with being able to reach your own doctor when you need it, come join our membership practice at In Touch Primary Care. You can enroll on our website, www.intouchprimarycare.com. So we'll see you next week. Have a great day.